So Dr. Olumide Okulaja has a progressive career path in the healthcare sector with multiple areas of focus on healthcare, healthcare financing, hospital management, information systems, healthcare quality, human resources management, and business development. He has an MBA in international healthcare management from the University of Aberdeen, Scotland, and an MBBS from the College of Medicine, University of Lagos. Previously, Olumide was the Director of Advocacy and Program Development at the Farm Access Foundation in Nigeria. In his erstwhile role, he led the World Bank Group's engagement in Ogun and Lagos State, and as part of the team working on the Kwara Community-Based Insurance Scheme Nigeria on policy and regulatory issues. He was also a part of a World Bank team supporting the strategy of Nigeria in attaining universal healthcare coverage. He was the interim partnership lead of the Nigerian Consortium of the African Health Markets for Equity, a $60 million Pan-African project funded by the Bill and Melinda Gates Foundation and the Department for International Development, UK, to address impediments to private sector participation in delivering quality healthcare to the underserved. He also sat as the chair of the AHME World Economic Forum Ogun State Project Management Unit on the 14th initiatives to leapfrog activities within the Araya scheme in Ogun State. Olumide previously served as a member of several technical working groups, such as the Lagos State Core Team on the implementation of the Lagos State Health Insurance Scheme, the Lagos State Technical Working Group on Private-Public Partnerships, and the Lagos State Technical Working Group on ICT Implementation for Health. In the beginning, I did mention that our speakers have been phenomenal with amazing and fantastic profiles. I mean, I have here coming up stage Dr. Olumide Okulaja to deliver his presentation. Yeah, a round of applause, yes. I mean, because his profile is incredible and amazing. So, ladies and gentlemen, join me as I welcome our next speaker, Dr. Olumide Okulaja.
Thank you very much. Sometimes I wonder who they're introducing when they read out that profile. But before I even say anything, I think I'd like to tell everyone to please give a round of applause to the host and his co-host for doing such a fantastic job over the last 3 days. I don't think it's easy standing here and speaking and introducing and making sure that everybody stays involved in the conversation. I'd also like to recognize my boss, the Honourable Commissioner for Health. Please give him a round of applause. He's a fantastic man. And he's also the pioneer of everything that we're seeing today. So we thank him. Over the last couple of days, I've learned so much and a lot more working closely with the Honourable Commissioner. I'm a health financing specialist, health economist, so I'm usually interested in the money and sustainability and how programs will be continuous. So in my introduction into biosecurity, the Honourable Commissioner, has been a worthwhile journey, and I've learned so much more beyond just the business of healthcare. So today I'm going to be speaking on the critical role of the private sector participation in health sector development in Nigeria. At heart, I'm a socialist. I fundamentally believe, I said at heart, I fundamentally believe that a government should be in charge of the economic resources of its environment and use those resources to provide goods and services for her people, because it's their responsibility. And a lot of times, several governments have tried to do this, but there are some certain impediments that can result in their inability to make this happen. And I'll just quickly like to discuss some of those things. So, I'll go straight to the point. I look at the economic landscape of Nigeria. Nigeria is an oil-rich country that is poor, and that's an oxymoron. If you look at the the revenue that Nigeria generated last year, this year we've not been able to calculate it, but last year we were able to calculate it from a figure that they were expecting to generate of about maybe 9-point-something trillion. Nigeria was only able to generate 3.9 trillion naira. So it was only able to achieve about 46.6% of its target. You look at the debts that Nigeria has as a country, and you look at how much of that we're spending on servicing that debt. So there's another economic index that we look at. It's called the debt servicing to revenue ratio. And what that just basically means is how much of the money that we make as a country, how much are we using to pay or service the debt that we have. In 2020, in the first quarter of 2020, it was 99%. At the end of the year, it was about 98%. And this basically means, and it's one of the first things that we do as a country, when we receive all our money, the first thing we need to do is to pay our debt, or at least service it, which basically is to pay the interest on it, or the requirement that you need to pay. And we use a whopping 3.26 trillion. So imagine that we make 3.9 trillion, and we use 3.26 trillion to service debt. We've not even started with the country. Now, we look at the total expenditure for 2020. It was about 16.3 trillion naira. That was our total budget that we expected to spend. And the allocation to health was 5.5% of that. Now, there's a big difference between allocation and performance. So it's one thing to allocate, it's another thing for the budget to actually be released to do what it's supposed to do. And you look at the total health expenditure in Nigeria as at 2020, it was about 6.7 trillion naira. And 77.9% of this was private sector, while 77.2% was out of pocket. So in a country where majority of people live way below the poverty line, they were still able to pay 6.7 trillion, at least 7.2% of that out of pocket. This basically means that people actually pay for healthcare, and they want to pay for healthcare if they have good access to it. But again, it also shows the failure of our economy in people actually paying out of pocket. Another index I wanted to look at was the analysis of the GDP of this country over the last couple of years, and I started from 2014. And as you can see, in 2014, we had a very strong GDP. It was about $546 billion. As at 2021, it's 440, albeit lower, but it shows that there's a progressive increase in our GDP. So Nigeria as a country has a very strong GDP. And in fact, we should not be going through what we're going through. But there's a huge oxymoron in that. You look at the contribution of the Nigerian government in terms of our tax GDP ratio. The tax GDP ratio in Nigeria is about 6.3%, which means the amount of money that we're able to generate from taxation, which is second to our only other source of income generation, which is oil, contributes just about 6.3%. The average for OECD countries is about 34%, and for African countries, about 16%. And the IMF has said, for you to have any form of economic development, you need to contribute just a little above 12.75%. Nigeria is wavering at 6.3%. Now, this is a very interesting slide also, because you look at our debt profile. That's another economic index that we use to look at the strength of the economy of a country, the debt to GDP ratio. And Nigeria's debt to GDP ratio is looming at about 35% now, which is not bad. It's actually not bad. The debt to GDP ratio is an economic index that is used to analyze the ability of a country to pay back its loan. And countries are said to start getting into trouble when they're at about 70-something%. So Nigeria at 35% is not bad. But the problem is that our debt servicing to revenue ratio is 98%. So where is all this money? And that's a question that everybody needs to begin to ask yourself. So this quickly shook me out of my utopia of being a socialist to say that we can continue to ask for more money. We can continue to advocate. In fact, we can continue to try to fund sensational issues like the COVID pandemic. And I call it sensational because it's something that attracts a lot of funding and takes attention away from other indices that might require attention. But the problem is that there is a finite amount to the resources that is available. And how we begin to manage those resources determines the sustainability of any intervention that we create. Now, look at the fiscal policy. And I hope I'm not boring you with all these figures, because it's important that we go through some of these things. A lot of the things that this conference has focused on so far is what are we going to do? The question is, how are we going to do it? And where are we going to get the money to do it? Biosecurity is not a cheap intervention. It is something that requires a lot of funding. So where is this money going to come from? Let's look at our proposed budget of 2022 and mark it against 2021 budget. The aggregate revenue that was proposed in 2021 was about 8 trillion. For 2022, we said we're going to do 10 trillion. There is a 24% increase in that. But let's look at the history and see how successful we've been in actually achieving our aggregate revenue. You look at the aggregate expenditure. In 2021, we were going to do 14. In 2022, we're proposing 16. An increase of 12%. A lot of the deficits that we have are currently being funded through loans. You look at the projected budget deficit. For 2022 already, we're looking at 6.2 trillion as our projected deficit. Please take note that our debt servicing to revenue ratio is already 98%. But we're already looking at borrowing more money to survive for next year. The FG spent about 1.8 trillion on debt servicing in the first 5 months of the year, representing 98%, and the total revenue generated in the same period. Total aggregate revenue generated by the federal government between January and May stood at 1.84 trillion, representing a shortfall of 1.48 trillion, compared to the expected of 3.32 trillion. So clearly, in terms of making money to fund not just healthcare, but all interventions in this country, we're in trouble. And if we do not begin to look at alternative sources of making money or sourcing for funds, then we may not be able to sustain a lot of the interventions or brilliant innovations that we propose. When we look at the domestic resource mobilization for healthcare, apart from taxation and healthcare efficiency spending and social health insurance schemes and donor spending, one of the biggest ways that we can actually look at in financing some of these interventions is the private sector. But the private sector is highly atomized, it's fragmented, it has poor quality oversight, and sometimes they don't have that focus to do what they want to do. So it is important that in engaging the private sector, government begins to look at a common ground and common interest so that they also know that it's going to be a win-win situation. A lot of times when government looks at the private sector, they look at them for the provision of services. However, there are other things the private sector can be useful for. One, in financing. Because one of the main reasons why our debt to GDP ratio is so high, or is so good, is because of the funding that is available in the private sector. Nigeria has a very vibrant private sector, thriving. Unfortunately, we've been unable to tap into that because we have a formal to informal ratio of 20 to 80%. So it's very difficult for us to tax the informal sector efficiently. Sometimes not at all. Sometimes last year, the last administration, the erstwhile governor of Lagos State, was saying that Lagos was only able to tax about 600,000 people effectively out of 24 million people. And yet, we expect social services. How possible is that? We don't pay our taxes, and yet we expect governments to be able to raise revenue from trees and pay for all of these things. It's important that there must be a connection between the private sector and the public sector, and we must find a common ground. It's important that we bring them to the table early enough so that they understand what we want to do, and they partake in the definition of the strategy and also in the implementation. Some of the innovations and interventions that have financing attached to them that governments have implemented in the last couple of years have only targeted public facilities and public interventions. How are we going to bring forward the private sector? One of the things that we tried to do in Lagos State was to begin to harness that opportunity. And I'll just quickly talk about the private lab consortium and the inclusion of the private sector in the isolation strategy. A lot of people have talked about that, but it's important to also note that it was not something that we did off whim. It was something that was strategically decided upon. And it was not an easy strategy because we also understood the backlash that we would get from the public in saying that some of these interventions will be provided by the private sector. And unfortunately, anything that is provided in the private sector does not come for free. I heard something yesterday and I felt it was an oxymoron. Someone said that we want to deliver services in the private sector, but we don't expect them to make money. And I laughed. I said, how do you expect a private sector organization to do business with you and they don't make money? The very essence of them being private sector is for them to have incentives. So it's important that we also disillusion ourselves from some of these unrealities and look at how we can work with the private sector to ensure that even if they make profit, it is not at luxury rates, but it's enough for them to sustain whatever intervention that they need to do. At the beginning of the pandemic, the Lagos State government, through the COVID-19 response, was solely driven by public sector laboratories and hospitals. But very quickly, the Honourable Commissioner and Mr. Governor realized that this was not sustainable because every memo that he took to the governor required huge chunks of millions of naira for him to do or bring out. We also have a lot of people that take advantage of, in quote, social services. And so this exponentially increases the amount of monies that are spent and what is available for other sectors to be drawn from. So very quickly, we began to look at how we can still maintain our social cap whilst including the private sector. And so we brought in the private laboratory consortium, we brought in the isolation strategy. And because of these decisions, Lagos State accounted for 25% of all testing done in Nigeria alone. So it wasn't a function of who paid for the test or how the test was done. It was a function of could we ramp up our testing strategy to a point where we were able to make informed decisions to manage the pandemic and save people's lives. The inclusion of the private sector started with the introduction of a number of private hospitals. And in fact, when this started initially, there was an outcry. But eventually, people saw the use. And in fact, you had individuals that refused to go to public facilities. One, because they did not want to be seen in them, and two, because they just didn't trust the structure. Nobody's fault. But it was important that we ensure that facilities were enough for everyone to be able to access service. And in the bid to ramp up our testing capacity, we also included private laboratories into our testing strategy. Now we look at this. Initially, this whole circle was blue, meaning that it was only government that was paying and performing tests in Lagos State. But very quickly, you can see that a total of 798,000 valid COVID tests have been conducted within Lagos State alone. This is the power of the private sector. This is the power that we must harness when we begin to look at interventions in our healthcare systems. We must begin to dissuade ourselves of the ideology that we can do it alone as government. Let's look at the fiscal policy, the budget of the Federal Ministry of Health, of which over the last couple of years, we've had a performance of wavering between 50 to 60%. When I talk about budget performance, I'm talking about the amounts of monies that are actually being released. And also understanding that you have a ratio of 80 to 20 in recurrent to capital expenditure. Now, when you talk about recurrent expenditure, this is the monies that are used to pay for the status quo, for salaries, for consumables. So things that government cannot do without, or else you would have an outcry or an outroar because salaries will not be paid. But the most important part of the budget is the capital expenditure. And the capital expenditure are the investments that are made to improve a system. So for example, if a new hospital is to be built, or a new PHC, or a new equipment was to be bought, it will come from your capital expenditure. And if you look at the health budget, for a country of 200 million people, on the average, you have 50 billion naira for capital expenditure. If I was to ask the Honourable Commissioner how much it will cost him to build a general hospital in Lagos State alone, I'm sure he'll tell me something between 20 to 30 billion naira. And the federal government is allocating 50 billion in 2019, 46 billion in 2020, and 131 billion in 2021. So we must begin to face these realities that there is really limited resources available in government to improve our healthcare systems to a level that we will be proud of, or that can actually take us out of the quagmire that we're in with our women dying. I mean, one of the things that we've talked about a lot is biosecurity here and the impacts of COVID. But again, we must remember that in the midst of this, Nigeria still holds the baton for the highest number of women that are dying from preventable causes during delivery. Also responsible for the highest number of neonatal deaths, NCDs, malaria, sickle cell. And so it's important that we must begin to think economically how we will raise funding to be able to solve all of these interventions. Now, I look at state governments also, and I look at their budgets. And a lot of times, governments don't like it when scrutiny goes into the budgets. I mean, when we talk about the interventions, and you have a state governor coming out and saying he's going to build 20 new hospitals, everybody claps. But again, we need to look at the budget to see how realistic that is. And even though a lot of our leaders have made these pronouncements, you look at their allocation to healthcare. Only maybe 1 or 2 states have actually attained the Abuja Declaration of 15%. Lagos State hasn't even attained 15%. But Mr. Governor has promised us, and he has fulfilled that promise by gradually increasing the percentage allocated to healthcare. And hopefully before he finishes his term, we will be at 15%. But again, we need to look at the budgets. Now, COVID is something that has woken the world up. It was terrible, but it was also good because it exposed us to our underwear. It let us see clearly the gaps in our healthcare systems, and it was able to show us that we are nowhere in the provision of quality healthcare services. Now, what is an external shock? An external shock is an economic term that comes from outside a domestic economic system and greatly affects that economic system. COVID has been the greatest external shock within the past 2 years, affecting every country in the world. And as a result of this external shock, the resources of most governments have been stretched to focus on the pandemic, especially in expenditure on human resources for healthcare. Now, when you look at the very impact of an external shock, one of the things that it has done is that I'm sure that we all are aware that we have lost a lot of doctors and nurses to COVID. So again, the availability is limited. And if you are to encourage doctors to face this pandemic or face any other pandemic, you would have to increase their salaries or pay them allowances. But you have a finite resource purse. Where is this money going to come from? Government will require private sector partnerships to cover all the gaps within the healthcare system. Why do we need the private sector? While the government needs to increase its capital expenditure, it cannot fund the healthcare infrastructure gap alone. Government needs to optimize resources by building reference centers of excellence while leveraging the capacity of the private sector to meet the healthcare supply need. How can we get more healthcare per dollar, per naira, per kobo? Government needs to be creative. We need to be innovative in boosting healthcare-related economy by leveraging on the private sector. What are the opportunities? One of the biggest things that I think we as government actually miss out is that when an external shock, such as COVID, happens, it's not just governments that are affected. It's not just our finances that are affected. The private sector's finances are also affected, so they're also very eager and anxious to ensure that we're able to come together to solve this problem. So it is very obvious that private sector and businesses are at high risk of severe losses when public system functions suboptimally. Therefore, the private sector needs to be proactively engaged in building a strong and resilient health system and not sit on the fence. Investments in issues such as roads, bridges, are seen more viable than in strengthening health systems. One of the biggest things that one of the questions that have been asked in recent times is vaccine equity, vaccine nationalism. Why do the developed world have more access to vaccines than the developing world? And why don't they give us their vaccines? And very quickly, with the person asking me, seeking some form of sympathy or empathy, I said it's not their fault. It is our fault. Because we have the resources to build these structures. We have the funding to build these structures. Not in the past, in the present. Because if we're able to effectively engage the private sector and partner with them, then we may find the funding that we require. A lot of times we are busy chasing the $1 billion that is in medical tourism, when we have $16 billion that is floating in our economy through people's pockets seeking for healthcare. So the private sector can assist in increasing efficiency and effectiveness, and the partnerships between private actors and public sector partners and recipients can sharpen the strategic focus of government agencies. So when we want to develop an intervention, it is important that at the very beginning, not in the middle, not at the end, that governments invite the private sector to the seat and begin to engage them. How do we solve this problem together? Because we're in it together. Public-private partnerships can reduce the burdens placed on governments to provide certain goods and services immediately. and over time permitting the public sector to focus on other important strategic priorities. One of the things that we've been able to do under the leadership of the Honourable Commissioner for Health in Lagos, and I'm not sure if he wants me to say this, is that our COVID response is private sector driven in Lagos right now. 70 to 80% of our response is private sector driven. And it has enormously reduced the burden on government to continue to fund this endless hole. For-profit businesses can provide important templates informing the design of public sector programs. Someone told me something when I was still in school. It says, poverty breeds talent. He said, when you are poor, that's when you realize that you have talent. When a company realizes that there is incentive or there is some form of profit to be made, however little, then it brings forward innovation. And that is what the private sector represents. However, there are some policy factors that we need to consider when we think about including the private sector. One, no matter how broke a government is, it must still commit resources to healthcare, budget-wise and drawdown. It, however, must be targeted in a way that it will engender returns. And when we say returns, we do not mean profit. We mean social, or in some situations, financial capital that can be plowed back into the system to... My slides have gone crazy. Here. Okay, it's still the same thing there. Yeah, can you please take it? Yes, thank you. The second thing is we must begin to look at health coverage and financing mandates, i.e. health insurance and or strategic purchasing. Policies need to be put in place to define how the demand for healthcare will be financed through effective public-private partnerships. There must be a commitment to equity and solidarity. Policies must be put in place to ensure that there exists an egalitarian system through solidarity and the availability of subsidies for social safety nets. Now, one of the biggest mistakes that we make as governments and even as a people is that we try to define social programs for the poor. And I think we need to begin to change that narrative to see how we can define programs, period, and then see how we can bring the poor on board to access those programs. Because there's no difference between myself and somebody on the streets when it comes to the accessibility to healthcare. Everybody must have access to the same healthcare services. It is a fundamental right, and it is a principle that we must adopt as a government and even as a private sector. There must be a consolidation of risk pools. The more fragmented our risk pools are, the weaker they become. That is why a lot of us in this room pay such huge premiums for our health insurance, because our pools are fragmented. But if we bring our pools together, then we make it stronger, because then we have the power of a monopsony and we have a strong purchasing ability to buy healthcare from both public and private providers. There must also be a recognized limit to decentralization. I'm a huge proponent of decentralization, but governments must not, in the bid to seek efficiency and effectiveness, give out their birthright. They must also know what it is right for them to do and what roles and responsibilities must be given to the private sector and the ones they must keep. And of course, we must seek ways for private financing. And the only way to seek ways for private financing is to ensure that we leverage on the private sector and create win-win situations. What are the effective ways that we have learned in Lagos to manage the private sector in a public healthcare system? One, we have adopted a central planning approach system in some of the interventions that we have done. Now, there are three main types of health planning. You have your dispersed, you have your focused, and you have your central. In your central planning system, basically you are leveraging on both public and private financing to define what exists in a healthcare system. So there is a limited amount of overlap. And so all areas of a healthcare system are covered. And through this, we've been able to ensure that we provide adequate services, especially under the COVID response. We also included the private sector very early, and there was a clear communication strategy that commenced from the incident commander all the way to the grassroots. Private sector inclusion is necessary. In a country like Nigeria, where private sector provides over 70% of care, the inclusion of the private sector in the health system is very, very, very necessary. There must, however, be a need for regulation, and the inclusion of the private sector should be regulated with mechanisms that will protect the residents of the state from unnecessary profiteering like price control and so on and so forth. Thank you very much.